Hey guys, Dr. Brodsky here. Welcome to the last month of your pregnancy, month number 9, weeks 36 to 40. This is the toughest time in pregnancy where time just stops. But I promise you the baby's coming, it's gonna be fine. All this discomfort is temporary and you'll be so glad you did it. You'll forget about this part later when you have your 10th baby, right? So things you can expect are more and more pressure, obviously. This baby is gaining a lot of weight, like half a pound a week. So you're gonna feel that. Lots of heaviness in your pelvis, lots of low back pain. You may have more mucousy discharge as that cervical mucus is coming out, and increased contractions as well. So you wanna wait for actual labor until they're very intensely painful and rhythmic. You wanna count from the beginning of one contraction to the beginning of the next, and once they're about 5 minutes apart and last for an hour, come to the hospital. Sometimes if I have a patient with special circumstances that I want to come in a little sooner rather than later, I'll talk about that with them. So ask your doctor about what they recommend for labor instructions when you go to the hospital. Things also to check with your doctor about or to expect are you're going to start seeing them weekly, so they're going to be checking your blood pressure often, asking you about signs of labor, leaking water, any bleeding, any other unexpected things that you're worried about. You also may expect some spotting when the doctor checks your cervix. That's very common and very normal. The average first-time mom has her baby in the 39th or the 40th week. So during this time, you should have a full-term, healthy baby, but be aware that's the most common time period for that to happen. You may also discuss some indications for induction with your doctor. So you may get to the point where you're 39 or 40 weeks and the doctor feels that you need to be delivered for one reason or another. And in that respect, you can talk with your doctor about medications they usually use, and if and when they like to do elective inductions. Elective meaning, I'm tired of being pregnant, let's get me delivered. So talk about that with your physician as well. You also, if you go over your due date, may start to have your water level being tested on ultrasound. It's called an amniotic fluid index. The doctor may start checking that to make sure that isn't decreasing. If you pass your due date, that can happen sometimes. Things for you to do: put the car seat in the car, that baby's coming soon. You also want to look out for headache, severe headaches, that's the warning sign. Vision changes, vaginal bleeding, contractions, gushes of fluid. Ask your doctor about delayed cord clamping. Sometimes that's a issue for some parents and they want to get more information about it. You want to also ask about the basic newborn medications that your baby may get in the hospital at birth, which usually include vitamin K injection, azithromycin ointment on the eyes, and the first hepatitis B vaccine in the series. Routinely at the hospital, depending on the state you live in, babies are screened for up to 31 genetic conditions just by a little prick on their toe to get blood, and it's sent off to the state to make sure that they're healthy. So that's something routinely that'll be done at the hospital also. And then double check that everything's in your bag, and you may have already done it, but make arrangements for other kids if this is not your first baby. That's it for month number 9. Congratulations in advance, you made it, you're full term, that's awesome. Check out my other videos. Thank you for watching this one, and you can always find me at drbrodsky.com.